Welcome everyone to Chart's free webinar series. Today we have Ashley Hurd and Felicia White presenting on managing mental health and addiction in the hospitality industry. Welcome Ashley and Felicia.
Thank you. Good afternoon, everyone. See lots of familiar names that are popping up in the participants list there. So it's good to see everyone join us this afternoon, virtually see that is. And a couple of things I want to get out of the way before we jump in. One, I'm excited to be co-presenting here with Ashley Hurd, not to be confused with Amber Hurd. We heard there may have been a little mix up there in one of the communications. So Ashley Hurd is with us, and we'll get to who she is in a moment here. And then, of course, myself, Felicia White, I'm the Director of Franchise Training with Scooters Coffee. If there are any Starbucks individuals on the line or other coffee brands, I apologize in advance. Scooters Coffee is the best coffee out there. Get that out of the way. And if you hear my dog snoring in the background, he is resting and recovering from surgery that he had yesterday. So I'll apologize for Trevor in advance for that piece too. So in addition to being the Director of Franchise Training at Scooters Coffee, I am a member on the board of directors for Chart. As Tara mentioned, Chart is a great organization, lots of fantastic resources that are available to you for those in the training industry, especially related to hospitality and hotels and restaurants. So please take a moment when you get a chance, go to the website chart.org. Check out some of the other events that we have coming up, including other webinars, regional training events, as well as the conferences coming up too. So I want to introduce here my co-facilitator, and really she's going to be doing the bulk of the work, Ashley Hurd. Ashley is an experienced lawyer and HR leader who worked for organizations including Yum Brands and McKinsey. She founded the Manager Method and to provide training and tools to help managers and employees across the industry work better. So if you've seen and follow Ashley on LinkedIn, you've had a chance to check out the helpful tips that come across from an HR perspective in the form of what I find to be really fun and engaging TikTok. So Ashley, I'm going to turn it over to you to say good afternoon to the group that's joining us.
Hey, thanks for that introduction, Felicia, and thank you so much, Tara and Chart, for having me come as well. I appreciate it. It's such an important topic, and I mentioned this in my LinkedIn, but Felicia and I first met each other 7.5 years ago. We were sitting at a table together at the Women's Food Service Forum, WFF conference in Orlando, and we've been in contact ever since. And so I know Chart has built a lot of really great networking connections, and so I just think it's fantastic to be able to leverage that network and talk with people within the industry and all the unique challenges. So I know we'll tackle a couple of those today, and I'm happy to be here.
That sounds good. And as Ashley mentioned, we're going to go over today and have some really engaging discussion. And we want it to be engaging around this issue of mental health and addiction in the hospitality industry. As we're going through this discussion, feel free at any time to drop messages, questions either in the QA box or in the chat box. I'll be keeping an eye on both of those throughout the session. So you don't feel like we'll pause towards the end, start and try to get about 15 or so minutes towards the end for questions and answers. But again, you don't have to wait until that point. Feel free to drop something in the chat, and we'll keep an eye out for those and answer those as we go through. So what are some of the things that we're going to be discussing today? We're going to look at first why mental health and addiction needs to be addressed, and why is this an issue in the industry. And this is something we've discussed in you probably have seen lots of either writings about this, you've attended other webinars, you've heard about it in conferences. And so it is a big issue, especially as we're coming from post-COVID. And so we'll start first there. And then what does that look like in our industry, and how is this impacting ourselves, our team members, our coworkers? We're going to dig into some details around there, and then finish up with what are some actions that we can take today to really move forward and help ourselves and help, as I mentioned, our teams to be able to combat these issues.
All right.
So I was looking at some of the stats around mental health and what are some of the things that are happening. And one of the items I like to point out is that this goes underreported quite often. And so some examples of the mental health issues that we see happen are things like anxiety, depression, anger issues, PTSD, OCD, paranoia, eating disorders, and these are continuing to be creep up and are the symptoms of which are seen at more rates more often. We see that with this within our industry is in the top 20 for suicide and clinical depression. So high pace, high pressure, but again, coupled with the other challenges that are happening as well, and Ashley will go into more of that. We see that's where we fall in. And then but looking at the interesting stat from 2012 to 2015 is that we're starting to see this was the highest increasing industry for female suicides. And our particular population, we know has when it comes to our industry, there's a high presence of female workers within the industry. And so that's something to be mindful as well. And then how does this look from an addiction standpoint? They have a high increased use of alcohol, illegal drugs, and the abuse of prescription drugs is prevalent. From a statistical standpoint, we are #1 at risk industry for illegal drugs use, and then number 3 for alcohol use. And this is when it comes to this restaurant industry. And in any given month, these stats are jarring that 11.8% of binge drinking occurrences happen, 19.1% of individuals report illegal drug use, and then 17% are diagnosed with social anxiety disorders. And this comes from that we see based on some government stats. So mental health and addiction, they can go hand in hand. They have a huge impact to the industry. And so, but there are things that us as trainers, we can do to support our teams, we can do to be aware of this and be mindful of it. And so I'm going to turn it over at this point to Ashley, and she'll go into some more details around what we can do to how this further about how this impacts the industry, but also what we can do to make a difference.
Absolutely. And I echo Felicia saying those, welcome, of course, to any of those watching the recording and those here live, feel free to drop your questions in the chat or the Q&A so we can tackle those. But we'll talk through why this matters to the business and why these are so common. And we'll really then get into some of the practical actions you can take. And so while this will be recorded, feel free to take screenshots at any point if there's resources that are helpful as we get to those slides as well. So why they matter to the business. I always say doing the right thing, no matter what you're doing, is the right thing to do, especially when that comes to things like mental health and addiction. That being said, a business is a business. And so it can be important to understand the business case. If you are going to be allocating or you're encouraging your teams as you're going to the different locations within the hospitality industry or talking to leadership and convincing them to spend time and energy on this, it's important to be able to show how they impact things. So there certainly is a human toll. I hope nobody on the call has experienced this, but I know it's all too common of the human toll of when things happen, an overdose among team members or mental health. And these are very triggering topics. And so we want to be very mindful that these can be very sensitive to any of the attendees here on this and in the recording. But this human toll can't be discounted. What can that look like? It can also be things like absenteeism when you have mental health and or addiction issues. That can lead to a lack of staffing. And as we know right now in the industry, staffing is certainly not at all around highs as it is. So when you have excessive absenteeism, it can make the problems even harder. Productivity. So you may have those show up, but when you have individuals that are under the influence, or you have individuals going through a mental health crisis, if they're not really there, then they're not often doing the level of work that you're expecting or those interactions with especially customer facing roles. And then turnover, when you have individuals, if they're absentee and they're not showing up, and you have to do they're there, find a replacement, or the voluntary turnover, involuntary turnover, all of those costs and the retraining, as you all know too well, are rampant already in the hospitality industry. But when you bring in mental health and addiction, they can again make those challenges even worse. So we talked about the statistics that these are common. In some of these you may recognize, but others you may not have thought about. But why are they so common in the hospitality industry? There's regular work schedules. Think of, different may have double shifts. So someone's working these long hours. They look to substances to keep them alive. Canceled shifts that can have mental health if that's budgetary challenges. Oh, there's not enough work for you today. We're taking away shifts. Okay, that can add stress to someone that's already going through some mental health. Late shifts, late into the night. Again, those substances that people take to stay up late, or when work, you get off shift at midnight, 1 a.m. or later, and you keep the party going. Those type of things are more rampant in the hospitality industry than they may be in a corporate environment that talks about the 9 to 5. 9 to 5 often isn't realistic in the hospitality industry. The labor pool, often lacking support and health benefits. So whether you have a pool that falls underneath that minimum, you're not required to provide health insurance at your organization, or you have individuals that fall below that normal 30-hour-a-week threshold to get benefits. The hospitality industry notoriously does not have medical benefits provided as part of their employment. And so by having that, they may not be getting regular checkups with their GP. It may not be feasible to go into an urgent care. And so when you don't have that, you don't have a mental health or any type of health professional that's giving that assessment to say, hey, are you doing okay? And recognizing that. High stress, say perfectionism and feedback. When you're having customer-facing environments, there's often this expectation. Look at what's going on with James Corden over the last few days, of the back and forth of Instagram comments back and forth about experiences with staff. But when you're working with clientele, be it a celebrity or anyone coming in for an experience, there is this expectation that things go well. And that can be in the hospitality industry, especially on the mental health aspect of if something goes wrong, then they take, all the trappings and feelings of that. And then that feedback, this isn't, again, the corporate environment often where you're having that annual review and those things. It may be real life, and every night or every day or every shift, you may be getting that feedback, which comes in the form of the complaints. And so constantly wanting to ensure that you're delivering that experience. Low or variable wages. Just as a statistic, oftentimes in the hospitality industry, it's not as high paying. So it's those, or you may be dependent on tips. So you may have that huge, think about the restaurant where you have the huge table and you get no tip or low tip, and what that can add to your mental health, especially if you're facing higher gas prices or higher rents that a lot of employees are seeing. The industry norms in the restaurant environment, family meal, but within all aspects of hospitality, oftentimes if the shift is ending, going in, like I said, going to the after work drinks or clubs, those environments that often lend themselves more to having alcohol involved or accessibility to illegal substances. Pressure from peers or management to say, come on out for drinks with us. And someone on their own may not make that choice, but if someone asks, it's an invitation they accept. So a lot of those can be rampant. And then again, the access to alcohol or legal substances, it may be right there in the environment, or there may be colleagues that have it. And so it's when it's more available, then it's more used. So what it looks like. So these as well, how it shows for the teams. You missed or late shifts. So you have someone, and this really can be mental health and or addiction. And there can be other reasons as well. But oftentimes when you start seeing people missing these due to their challenges or consistently showing up late. If you see employees that have their appearance, they may be disheveled, could be unbathed, could have red eyes, their demeanor. And this is all these differences that you see. Someone all of a sudden being more quiet, someone being more tired, hyper than usual, an erratic or an outburst, a drawer or tip shortage, asking others for money, or, hey, can you give me that shift, in a sense of more desperation than just hey, can you help me out, or offering to help. And then changing their relationships inside or outside work, a romantic relationship that's ended. And a lot of this, one of the benefits, and we'll talk about this in the next slide, because a huge component to both mental health and addiction is having somebody else in your life, any aspect of your life, in person, have that connection with you and check in with you. And so while a lot of industries now are talking about all remote, hospitality is, of course, one that is in person largely due to the nature of what the business is. And so a benefit that you have in that as trainers, you can talk with the management and other employees in the locations about is being those eyes and ears. When you see those differences in employees taking a step, and some of these things you see, like a drawer shortage, third time's the charm. But as an employment lawyer, as in HR, a lot of times when I get these questions, and the way I used to think about these frequently are, this happened, what can we do? This is a disciplinary issue. And it was as I worked more in HR and worked more around, including hospitality environments, that you realize a lot of times there's questions of why that's happening. So we'll talk into when things go wrong, sometimes taking that step and treating someone as a human. You may still have to take different employment actions, but recognizing that a lot of these occasions may be the only ones in some of these employees' lives who are going through mental health or addiction challenges, to have someone take a step and see if they're okay. So these are all pretty unique to the industry. So what you can do and what you can train as trainers. So some of the most important actions you can take, and others, again, those managers, the other teams in the hospitality environments can take, are completely free, and others are nearly free. And so we recognize this because, you know, there's a lot of problems you can solve by throwing money at them. There's been a lot of money thrown at mental health, at addiction, but some of the most effective steps truly are free, or little asterisk close to it. And so we'll go through some of those. And that's where, as we get to a few slides, you know, have the recording, and you can certainly screenshot to look into some of these as resources for your organizations and the teams that you're working with as trainers. Okay, what you can do and train. So one is to have a list of resources, and we'll give you some of these. So it can be really helpful to have that accessible in the locations as you think about, you know, the labor law posters, you know, having that near the check-in, having that in locations where employees are getting that visual eye on it, or if there is some sort of intranet, having those. A big one is not just posting it and having it up there because, you know, people might look at it, but also promoting it. So if as a trainer or to train managers of locations, one of the most effective steps that a manager can take, or even as a trainer you can take, is as you're talking to employees and talking about, as we go through the new federal 988 mental health number, which is like the 911 for mental health crises, is saying, hey, we have this, not just having on the wall, but taking that to promote it, meaning pointing it out and saying, this is accessible, this is provided, this is what this can do, and plugging it in your phone. I have this saved as an emergency contact. So if I ever need it, or someone I love or someone I know needs it, I have it right here, and I plug it in and put it as crisis line or something like that. But having that can be a huge step, more than just putting on the wall. So that's the type of human interaction that those, especially training in the hospitality industry, have the benefit of getting in front of the teams. One-on-one time in shift huddles. So a big part of training, in addition to all the processes that you're training, is to have a couple simple steps, especially for those managers, but even other team members, is as you're having one-on-one time with, you know, your restaurant manager, your location manager, your sous chef, but just or different shift huddles, encouraging them to ask questions like, hey, how are you doing? All right, bye, have a good night and be safe. Adding that human component seems so simple, but it's words like that that sometimes people will reflect on, and that made all the difference to get them to take that step. And so encouraging to have those type of steps in the communications can be a huge one, in addition to just the skills-based or, you know, new product or new recipe training. Taking time to listen. So both as you're in locations and talking through, and it may also be seen, and you sometimes as a neutral or someone that's not in the location from time to time, if you're on site or you're around a group of individuals and you haven't seen them in a while, if you see a difference, talking to that individual or encouraging managers to take time to listen to them as well, to make sure that you're really hearing the individual and just taking a few seconds in those interactions to really listen, as opposed to just, you know, getting through the work. Same as look and watch. So listen, look, and watch are those steps that can be incredibly helpful, and especially those in the environment, and reminding managers, because even though this seems counterintuitive, as we all have full plates, especially if you're managing a large hotel or locations or multiple locations, reminding people of the importance of this can ignite the pilot light that really lends to the humanity that can help their teams. So following up if others say something. I say this, there's no perfect words, but saying something can be powerful. So if someone says, my girlfriend broke up with me, rather than saying like, okay, all the time in all through life, we have times where we're like, I don't know what to say back. But like I say, there's no perfect words. So saying, I'm so sorry. Are you okay? Do you want to talk about it? Basic things like that can help. And remembering their humanity, asking why even in their worst times. This is why I think as trainers, talking with managers to remember, as you have, we've all seen the situations where someone does something at work and you have to end their employment. Like I said, a drawer shortage or making a critical mistake, but encouraging managers as part of that to stop and say, even to individuals, we have no choice, but we have to end your employment. But I also respect you as a person, and I know you'll move on and learn from this. And I want to know, you to know that even despite this, I still care about you and I'm still here for you. Those basic words can mean all the difference to someone, even if you, based on whatever happened, can't continue that. So reminding you, especially at the manager level, this is more of that communication than the broader teams. But to ask the why and still show that care, even in those times, can really lend itself to both mental health and addiction.
And Ashley, if I could just jump in
Yeah.
here a moment, and if we could go back and kind of look at some of these here, and this, I think this is a great time too for if anybody has any additional, when you think about for that you want to drop in the chat or share with the rest of the group here as best practices, because none of these cost anything. So when we're just saying what are those free resources or nearly free, having actually asking a question and taking time to listen costs you nothing but that time, and it can be very minimal and can go such a long way. And when you look at those questions around hello, how are you doing, even just adding in how are you really doing, because we're programmed to say, oh, I'm fine, but no, how are you really doing today? How are things really going, especially when we know as a society, and we know what's going on in the communities that may be surrounding the locations. There could have been something that happened recently in that area that could be impacting the people that live there, and it's something. So adding that extra word or taking that extra step, and when saying that goodbye, good night, and be safe, just adding in, hey, and text me or call me if you need to. Don't, no time is too late, because we don't know what situation an individual is leaving and going home to when they walk out of the location. And so it's really important to just kind of think about adding that human step, and adding and remembering that why, that asking why, as Ashley just pointed out in that last statement, because these things are so huge, and they may seem so simple, but they make such a huge impact and could really make a big difference in what someone may choose or choose not to do in the next moments after.
I can't agree more. And this next slide talks a bit about that, and it's a slide that's been used previously in chart, and so it is a good one to screen share. And then we'll go into some of these resources that you can explain those, and that you can add to your list of resources that then you promote. And I personally put the 988 number in my phone as well, as I was working through this, and I hadn't done that previously, and so this reminded me to do that. And so I do think it's important. So this, I don't know if some of you may have seen this before. This is ALGEE, the action plan. ALGEE is ALGEE. And what these are steps, and these are 5 steps whether you can do if you're in location, but also that managers can do as well. So and I see through this talking about attendee had said they were really hit with Hurricane Ian and touching base with the employees. So many lost on top of an industry that has issues, compounds things, and appreciate these resources. And I mean, I know, Felicia, I'm sure you see the same. Hospitality is such an industry that, I mean, obviously no one else needs to say over the last 2.5 years what that's been like. But consistently, it's one that as society goes through challenges, often individuals in hospitality are really those affected. And so each of you as trainers, as you're working with broader employee teams, broader managers, you do so much. And so showing that care and reaching out when you have a natural disaster, I mean, it's showing that level of care. That's what you see. I mean, you look at a Glassdoor for any of these, people often go to Glassdoor for the worst of the worst. But if you look at a lot of companies in the hospitality industry, what you'll see from those individuals, especially those that are on the ground, will often have these reports where they talk about, my manager cared so much about me at this time in my life. And it's the type of stuff you don't forget about. And so oftentimes it is those free actions. So the ALGEE has 5 of these. And like I said, this is a resource for you, but also for managers in locations. So when they say, I don't know what to do, what do I do? While you don't have to be an expert, we'll talk about ways that managers or trainers, you can become more of an expert. Still, like I said, there's no perfect words. But so these are 5 simple steps. One is to assess for that risk of suicide or harm. Is there something going on? And that's again where that 988 number can really come into play. To listen non-judgmentally, giving reassurance and information. Hey, here's this. Let me show you these resources. This is what it can do. Encouraging appropriate professional help. Say, hey, here are these resources. I'm here for you, but it's also important that you find others that it can be really specific for you. So to encourage self-help and other support strategies. Hey, what can you do tonight when you go home to, who's with you that can ensure that you're not going to feel the pressure to have that drink. So talking to those individuals and then pointing them to resources, because neither you nor anyone in a location is necessarily going to be an expert. But this is one that I do think this algae can be helpful, and I think it's really, really succinct. So we'll talk through some external resources, just a few slides, and then we'll turn to the Q&A. Like I said, feel free to screenshot these as the animation pops through and you'll get the information. But so 988, so this is the one it's been rolled out fairly recently. This is nationwide. It's like a 911, but 988 is suicide and mental health distress. So a great part that people aren't always aware of is it's not just calling. I am in my 40s, so I talk about calling. Everyone else, as you may know in the industry, it's like text, WhatsApp, all that. But so text in particular, you can text 988 and get with trained professionals. And it can be for that person, or it can be their family friend. And that's something that's really helpful in particular as well in hospitality, because there may not be anyone for someone working in your location, your hotel, your restaurant. That employee may have others in their life that have mental health, and nobody's telling them about these resources. So by you having this communication can be a ripple effect for a broad swath of community that's not always getting that notification. So this 988, like I said, the best part I think is the text feature, because it connects them to trained professionals and they take over from there. So this isn't you having to guide that, it's pointing this to them. And so this is a great one for people to have in their cell phone number. Another is Giving Kitchen. So Felicia and I are both in Atlanta. Giving Kitchen is here and is just done awesome. This is really targeted to food service workers. And I don't know as much how that's defined for others in the hotel industry, but it's pretty broad as far as hospitality. And so if you go to the website, thegivingkitchen.org here, one particular is Mind Matters. So this is, I'll tell this in a second, but so this is, they have this free training. And so this is for workers, this is managers in the restaurants can take this. It's not long, but they offer this for free so they can feel more empowered and know what to say when they're seeing any challenges, especially focused on mental health in their locations. And so some of the testimonials on the Giving Kitchen in particular talk about I've lost too many to suicide. I feel more empowered to help in the future. Or good training, thanks for making it available. I wish I'd had it to help my friend who took their life. So again, so much of this isn't just to benefit the managers who are also going through stress and having their own challenges, including mental health and addiction, but all of the employees and then the communities beyond that. And so, so both of these are external resources. So I'll pause for a second, just to feel free to screenshot that one. And again, the website has all information. You can click through links and sign up. And so using that within your organization, again, free. External resources, certainly you're aware, I'm sure, ones of Alcoholics Anonymous, Narcotics Anonymous. There's also SAMHSA. So this is now the Substance Abuse and Mental Health Services Administration, which has a lot of really practical resources. A lot of the funding it has gotten is to really provide things that are free. So all of these have websites. Ben's Friends as well, which is more focused on hospitality industry. And so I include this for Ben's Friends. Again, all generally free. All these are generally free resources, but all of these, we always say some of the silver linings of the last 2.5 years have been opening up to meet people where they are, and where they are isn't always in person. It's some people want to go to an in-person meeting, not always possible. So all of Alcoholics Anonymous, Narcotics Anonymous, Ben's Friends, they have Zoom meeting. They have a lot of online meetings. They have them by late night. You can do by gender. You can do by a lot of different demographics. So people feel comfortable. And so it's really about meeting people where they are. And so all of these are different resources that you can list and talk through with teams. And so these are also testimonials from Ben's Friends. Yeah, I'm going to both, but both talking about what this meant and individuals that they have helped become sober and live productive, sober lives as employees. And I thought Anna's comment from my hometown of Louisville where sobriety can feel really impossible. And I know a lot that may have gone through some of those challenges. It can feel really difficult to think about staying within the industry if you have those challenges, but building those communities. And so some of these are really powerful testimonials that can speak to employees that may think, I don't know if this is going to work for me. So all of these are great resources as well that are all free. So we talk about nearly free. So nearly free is EAP. So as I said previously, especially in the hospitality industry, many organizations either aren't of the size to provide medical health benefits, or specific employees may not qualify for medical benefits. But an employee assistance program is different from traditional health benefits in that it is a program that generally organizations, so we'll talk through two types of them, through employer assistance program, employee assistance programs, or EAP, and individual ones. So for employer EAPs, the way that generally works is that an organization, and this can mean when we'll talk a bit about franchised in a minute, but this can either mean at the corporate level or a franchise organization can sign up for this. You generally pay a cost, and then for all employees and their dependents, which is like a spouse, domestic partner, children. I don't know if it's up to the 26 like medical benefits, but like this benefits their families, and so it's much less cost than medical benefits. But what this often is a set amount of counseling appointments. So it's not just a resource of, hey, you should reach out to this counselor. It's you can have 8 or 10 or however many free sessions in counseling, again, which can be virtual. So these employee assistance programs tend to be much more cost effective, even done at an employer level. And so they can often thread the needle between a full-blown health benefit program and nothing. So that's the employer kind of focus that you can look into. And so you can look through, and none of these none of these are sponsored or anything like that. You can always look through EAP in the hospitality industry. There may be local ones, but we'll talk through some of these options also for individuals as well to sign up for. So we'll talk about both of those. So one is organizations and individuals. There's this Navigate by 0 Hour Health. So if you just look up Navigate by 0 Hour Health, you'll come to their site. So it's really designed for hospitality, including food service, and it's like an EAP light. So it's this also has text message. So what this means is that if organizations sign up, for example, if an organization signs up for this, and it's generally a few dollars per month for all employees, then those employees have access to it in text. It's another one of those things that they also provide resources and training to ensure usage, because one of the gaps often in EAP programs is they don't go used as well. And often it's because it's like listed in that list, but there isn't that communication. So if an organization invests even a few dollars a month per employee in something like one of these programs, it's really important that it be vocalized and promoted. Even managers saying, hey, I signed up for that. I tried this out to see, again, without having to the extent people are comfortable, but that can really help to bolster that usage, to break through any of that stigma or nervousness that employees may have. So Navigate by 0 Hour Health is one example that organizations can sign up for all of their employees. And there's plenty others. So if you look up EAP, Employee Assistance Program, hospitality, there's plenty others. So another, and I know Felicia had just seen a presentation on this. So Serve Success Plus. So it's also, you can look this up. So this is really focused again on hospitality workers. So this is individual. So individuals sign up. Of course, if an organization, it's going to get used more or higher signups if an organization signs up and makes it free to their employees, but also recognizing budgets. This is $7.99 a month for individuals, but it has unlimited 24/7 teledoc, virtual doctor's appointments. It can also have savings on travel and consumer products. So like, while separate from talking about the mental health and addiction resources, a lot of this, in their materials, you'll see they have massive discounts on things locally going on. And so if you also think about your staffs, if they having access to get discounted coupons for things for themselves, their families, being able to spend time entertaining their family and getting savings to do that, there are mental health benefits as well. So again, this is another example of one, and this is where it's really directed towards individuals signing up and paying, but there's a lot of benefits to them. There's testimonials on their site of people saying like, I have saved far more than $8 a month in my like tickets to the zoo or amusement parks or whatever, and all that travel. But so these are examples that aren't free, but they're close to it, that can thread the needle if you don't have a full-blown medical benefit for your teams. So we'll do this and we'll turn to Q&A. So just 3 key takeaways at high level. again, is that mental health and addiction are especially affecting the industry, especially right now with challenges going on. With everything that's gone on the last 2 years, you've seen gas prices, rent, all of this, low staffing. How important it is as trainers to training managers and employees to spot the signs and even basic behaviors. And that employee training is important. Again, a lot of employees aren't going to be experts, but reminding employees, hey, check on each other. And if you see something going on, you may see something. And so telling employees, training those all groups to say, if another employee sees something concerning in you and talks to the manager and says, I'm worried about this person, that's not snitching. That's not tattling. But it's all about this team environment, wanting to look out for you and having those communications and reminding employees that you are there for each other as humans. So, and last is providing resources is key. So we've given you some that help start you with compiling your lists, but talking about them, promoting them, showing how to put those in your phone can be even more so. So that's our presentation. So Felicia, I'll turn it to you in case we have any questions. I know you had a couple in advance that you got, so.
Yes, I'm going to jump in with one of them, which is also a question that it was sent in earlier, but it is one that I have a question about as well, and I'm recently getting involved with, and it is around working with staff and individuals that English is a second or even third language for those persons. And so I'm going to ask that question. But again, before I do, by the way, if you have any questions, feel free to drop them in either in the chat or in the QA box, and we'll pull those up and address those for the group too. But in this particular question, what about locations where staff speaks different languages? Many resources are focused around these needs for support and offering these resources that you just covered, Ashley. But if I give out this website or this number, can they speak to someone who is going to be able to speak with them in their preferred language? Do you have any insights into some of that?
That is helpful. And I do, because I've gone through and was like trying out some of these. So like, for example, Giving Kitchen, which is Atlanta based, in that website, which I'll go back real quick to that address. Giving Kitchen, thegivingkitchen.org. So if you go to their website, then at the top, they have numbers that you can call if you see someone going through a mental health crisis or you're going through a mental health crisis. And that's a specific number. It's called help/ayuda. So not only is it English and Spanish, but they have a drop-down forms as well that you can put information in and someone will give a call back. So they have it in English, Spanish, Cantonese, Korean, Vietnamese, and Mandarin. And so a lot of the more common languages that you're seeing. And so a lot of these resources completely recognize the population and the language barriers you might otherwise have. And so that's an especially important one for managers to reach out, because that is a concern often with those individuals who aren't English speakers or aren't fluent English speakers, that especially feel that stigma of, I don't want to have a call and be even more difficult for themselves or a family member. But the Giving Kitchen, for example, does. And I believe 988 has as well different resources for different languages, those commonly across the hospitality industry. So it's a great question, and it's a really important one to include, that there are resources for those different languages.
Okay, great. Thanks for sharing that. I don't see any additional have come in just yet, but I do have another one here. And that's it. We had the one portion, one of the slides earlier on, we talked about just, asking those questions and checking in on people and seeing how they're doing. When you do have an inkling that something is going on and maybe you're getting that simple, oh, I'm fine, or there may be a little bit more to the story there. When is the right time to have that kind of a conversation, even if it's something maybe you don't pinpoint it to one particular team member, but do you have it in a group meeting? Do you pull people aside? Like what is the right way to handle that?
I'd say, just like there's no right words, there's no right time, but doing it closest to when you see something can matter. And some of us may have seen situations where you're saying the next day, I wish I'd said something last night, because even waiting a day, when you were talking about mental health or addiction, a day can mean life and death for someone. And so if you see something and you feel like you want to say something, sometimes it is talking to the manager. Hey, I noticed this. Have you noticed anything? But in thinking through what environment it is, if it's a broader team, then you may say, well, I don't know if I want to pinpoint this individual right now. Maybe I'll say to the group, hey, as a trainer, like I'm here for a specific reason, but I also want to remind everyone from our organization, we care about people. And so I want to remember my job is to check in, make sure y'all are doing okay. That's your leadership's job here at the location. And also as employees is to check in and care about each other, because oftentimes as coworkers, we might see each other more than we see our families at home. And so I just want to make sure my message isn't just, this is how you do this process, but this is how we want to work together and support each other. And so while I'm here, I want to check in and just see how y'all are doing. If there's any questions you have that I can help with or take back and get answers to, but to also remind each of you all to check in. And so that can then help if after the fact you're talking with individuals and teeing that up. So someone doesn't feel just like, oh, I'm being singled out in this location, and can also have the broader message of reminding people to check in on each other. And so that can make it a bit easier if you feel like, oh, there's somebody I want to have that conversation with. And again, as trainers, there's times you're going to be there and present. There's going to be other times when you're talking to the location managers. And so it's communicating with them how to do that. And so it can be but oftentimes them seeing you do it can make them feel more comfortable after you've gone.
Okay. And then this one may be pulling more. You may have to dig back into more of your lawyer, young brand lawyer days, or maybe even in thinking about some of the HR related. And you mentioned earlier that at times, depending on a resulting issue, something is, and there may be a infraction against employee policy, and you have to take the step of having to, it's now becoming employment issue. But if it is found out, though, that there's a diagnosed mental issue, there's a diagnosed mental concern, or there's a diagnosed addiction, that is also an illness. How do you move forward from that standpoint if there has now been something that has impacted employment, less using the example as you mentioned with tips or missing funds from the location? That's a clear employment concern. But if it's related to a mental health issue, how do you handle that?
Yep. And I always have to give my caveat that is I can't give legal advice to anyone. Again, lawyer life, that's the caveat you give. But what I say is, and I have two hats, and this is where, while I started out in employment law, I have this hat on my head that's employment law. My big wide brim has been from HR and in building that heart and that connection. So generally you can have, objective thing, like you can have, anti-theft. And if someone, you can have a disciplinary policy or even no policy. If someone, in America, all but Montana are at-will states, meaning you or the employee can terminate employee at any time unless there's an employment contract. Montana is a little funky, but while generally you have rights to make that termination, it does. And probably the question I've gotten most over my career is, how do we manage, especially with either mental health or really a substance abuse, if someone has this? And so I say a couple of things. One is to focus on the behavior and ensure that, or to focus on the action. So, taking action based on this. A gap I often see is people saying, well, this person's an alcoholic because these are the things they were late. They were late and their eyes looked red, and I'm convinced they're an alcoholic. And so I want to punish them. And, I can't have an alcoholic here at this location. And you say, well, you have to focus really on the objective, what you've seen. You can't jump to conclusions. And this is often where, as an organization, you want to get your own legal and HR in, because situations can really vary. But what I say is, at times you may have an objective policy. You may have no illegal drugs on premises, and someone has illegal drugs and they're terminated from employment. But that step to it that I do think that my big brim of Ashley is, even if you are making that termination, to say to someone, because the way someone is terminated from employment can impact incredibly their mental health or their addiction issues. And so saying, we have these as a business, we have to have these guardrails, but I am here for you. I want to give you some resources to help with, if any of these are helpful. And again, I'm here for you. I don't know what's going on. And I know I may not be the person you want to talk to right now, but I want you to know I still see you as a human. in that type of language. And again, there may be situations that have violence or things like that. And this is why I say, talk to your own HR and legal, but generally focusing on the objective behavior, not jumping to conclusions, meaning a diagnosis of mental health or addiction, and then offering that support in ways when it feels safe and reasonable to do so, can make a difference to your employees, even if they are no longer with your organization.
Okay, great.
Mm-hmm.
Thanks for sharing that. We've got a couple that have come in Q&A, and I'm going to read the first one, especially for those who may not have access to view this. Perhaps this is not a question, but an acknowledgement of persistence. I myself, as a trainer, have had a recent experience with my partner that refuses the support and resources offered. All I have done is persisted in offering support and checking in. Maybe either of you can speak to this or any lived experiences with this, and are there support groups for those of us supporting our teams and loved ones that are suffering?
I mean, this is what, if it's more of the crisis, and this doesn't sound what it's like, but if it's that kind of crisis in the moment where you have real fears about that person's own safety, that I think that's what 988 is for, is to say, I have, and that is also for people in the loved one, because those are resources that are needed, and continuing to provide that as support is really important. It can also be really frustrating, draining, and a lot of other adjectives that can be really hard. And so 988 can be helpful if it's more crisis, but I know Giving Kitchen in particular also has a lot of ideas of what to do and can provide very professional resources for those that are seeing this with loved ones. And so those, I think, go to those two, whether it's trying 988 if it feels crisis, or if you go to the Giving Kitchen website mentioned and fill out that form in particular, if this is more of an ongoing, not as urgent this minute, to look at those, and they can provide you with some of those resources, or they have training on things to do. And so I think that's where knowing who to go to get the professional resources is really helpful. And I think that I appreciate you raising this in particular, because I think there's a lot of individuals in the locations that you'll come across and who your managers will come across that are in exactly that situation. And that's where those EAPs can be really helpful as well, when they support dependents as well.
And I think when you're mentioning that EAP piece there, because especially when you have a person who unfortunately hasn't made the choice themselves to get assistance or take advantage of those resources, but and to that second part of the question, where how do you, as the individual that's trying to support them, or that's trying to that you have that loved one or team member or whomever, and it does impact you as well, because you're living through that experience too, that there are those adjacent groups, such as the parents of individuals who may be dealing with substance abuse issues, or partners or spouses, so they're kind of adjacent to the Alcoholics Anonymous type groups, and EAP resources are great ways to find out who those organizations are. How do you get in contact with them? Where they meet, and all of that. So also some things to keep in mind. And then a question for you, Ashley: how can an employee, specifically with a corporate brand, approach HR to discuss issues with their manager who is causing the stress to push the employee over the edge? Think quiet firing or gaslighting.
I'll address this in two parts. And one, I'll probably address to the broader audience, which is, as trainers, you work a lot with managers. And again, as trainers, you're working with a lot of train the trainer type, teaching out very technical skills or any of those type of corporate launches. But a huge part of it also is reminding managers, as they see things, is one of the best things they can do for their employees is to be on the lookout and then to do something about it. So if they see someone, or if someone approaches them and says, I'm stressed, and it can mean very different things in that field environment, or within a restaurant or hotel location, and a corporate environment. But no matter what type of the environment, I think it's really important for managers to be non-defensive and to try to help, even if ultimately it's a situation where the job isn't working out for the employee, or this isn't the right environment. But to be that resource, because when you have a question like this, which is, I can't talk to my manager, this is where you get into, quiet quitting. I don't know if everybody's heard about the term quiet quitting. If you haven't, then go check out Google. It's everywhere. But the idea of quiet quitting is someone that's often does not feel like they can talk to their manager, and that can bring on so much mental health and substance abuse. So I'd say it's really important as trainers that you reiterate to managers what their role is of being that source. Because if you're in a situation where an employee says, I can't talk to my manager, I need to talk to HR, So to answer the question directly, if you're at a point when you need to go to HR, ideally the way it works in an organization that's high functioning is that HR is able to be that conduit and say, okay, and talk to the talk to the employee, give you tips, or talk to the manager and facilitate that and get to a point where you're not feeling like that job is having burnout. Having been a realist, I know things don't always work out that way. So if you're at the point when you need to go to HR, there's times when, HR may not know what to do, or HR talks to a manager and the manager, goes nuts. And so I think it is important to have HR as a resource and be able to talk. And if you're in a situation where you feel like your manager's not going to take it, because something's going to have to be said to the manager. Ideally, in a situation, you're able to have that conversation with your manager. But I think if you can, giving it a try, talking HR and doing two things. One is talking specifically about those behaviors, but also having that, I want this to be a workplace where I'm coming, doing my best and contributing. I know others want that. And so how can we make that help? So that can be really in the corporate environment, or in the field. But I do think managers being able to hear and support their employees is incredibly important.
Thank you for answering that. Agreed. And that thought around quiet firing is really something to keep in mind there. So we've got another question that comes in, and who does HR talk to? So I guess maybe if you are someone who has some HR responsibilities or kind of wearing two hats, as some of us as in training organizations may tend to do, where did then you go to get some of those answers?
Well, I think HR, HR, a couple of things. So HR, people will say on my videos frequently on TikTok or TikTok generally is HR is not your friend. And I say, absolutely, HR is not your friend, because HR is not HR is not a one-sided thing. HR's job is to get to the right result. The right result means involving. So if it's a manager that's causing stress or some type of project, HR is going to have to involve that manager. It's as the case may be, unless you talk to HR and say, I just want tips on your tips and thoughts on how I can work better with the manager. And there's some HR that are fantastic about that, HR business partners. But if it's a situation where you just go to HR and you're like, this is a situation, I need you to help me, and you don't just want tips on resolving it yourself, HR is going to have to get involved. So HR, may for their own resources have, their own leadership they talk to, but generally HR has to speak with that individual. And I don't want to get us too much off the topic of this, but I think it's important to, as you're having conversations ever as an employee, to understanding with HR, what are the next steps? If you're telling HR, I want you to resolve this, asking what do those next steps look like? But oftentimes it's, as a conduit, they're going to need to resolve that. And so that can be helpful. But again, that's why I think as trainers, which I know you may be looked at, people may be coming to you and asking about payroll and your paycheck. I have seen that in real life. A lot of questions will come across, and but as trainers, you are often looked at as this safe person to talk to. And so it can be important as trainers to talk about if there's something that you're going to have to follow up with to somebody else, talking internally to your own HR about who do I direct this to, and telling that employee these are next steps. So an employee is not surprised if others have been told about this conversation. So I think
Thank you for that. And I know when you mentioned that comment about as trainers getting asked those questions that aren't necessarily in your wheelhouse, like, is my paycheck right? I'm sure, although we're only, everyone is in on camera, I'm sure a lot of people probably nodded their heads and smiled at the thought of that, because that's something we all can relate to. So I think we're coming right up on time here at an hour, and this has been really great. The questions that have come through, the conversation, the points that you shared, Ashley, those are excellent resources, and those are great tips to go back and be able to look at and review with the teams. But I think one of the important takeaways from this whole discussion here is to make sure that that awareness is key, right? Really just taking that extra time to check in with people, check in with our teams. One of the beautiful things that I find about our industry is it is people related. It is people focused, and we work with people. We're not just behind desk. We're working, just at machines. We're not robots. And not only do we get to interact with each other, but we get to interact with our great customers and vendors and et cetera. And so that's what makes it so fun and so great. But that also is why we have to be intentional about remembering who those people are and thinking about the humanity of it. And so really important to take that away. Think about these resources. Franchise organizations, especially, and those, a lot of you on the line probably work with a lot of franchise organizations. These are things that don't cost a lot. You don't have to have a huge organization to take advantage of. You think about $7.99 for an individual to sign up for Services X Plus, or being able to have just print out 988 and post it on a employee communication area, or considering some of the other lower cost items. That can go a long way, and it will save you a ton of money in the long run, and is a big benefit. So Ashley, I want to thank you for joining us this afternoon and sharing your knowledge and sharing your resources with CHART. Again, thank you for those who joined us this afternoon, and for those who will take a moment and look at it offline. We appreciate your time. And once again, I can't stress enough how important it is to not just listen to this and take this information for yourselves, but take it back to your teams as well. Ashley, final words that you'd like to share before we wrap?
Like I said, echo, retweet, all of the above, but it's so important. And so I'm so glad CHART is dedicating time and energy, and that all y'all that showed up or watching this, the recording, it's important. And so just by showing up and paying attention this year, I frequently tell people you're doing better than 99% of a lot of organizations. So thank you.
All right.
Thank you, Ashley. Thank you, Felicia. We will have the recording on the website by the end of the day.
Thanks, Tara.
Bye, everyone.
Bye.